Have you been looking for an effective method of family planning to use? I believe this video is for you. While a lot of women run away from artificial family planning method, a lot of women also use it. A lot of women also embrace it. So in this video, I am going to be telling us about the artificial family planning methods. Before I continue, let me give you quick advantages of using artificial family planning method. Number one, it is very effective. Oh yes, artificial family planning method is very effective. Number two, some methods of artificial family planning method can prevent you from having sexually transmitted diseases like HIV, gonorrhea, chlamydia, syphilis, and the rest of them. Number three, using the artificial family planning method can also prevent women from having some types of cancers like the cervical cancer and the ovarian cancer. Although the artificial family planning methods also has its disadvantages, but I'm going to be telling us the disadvantages of using these methods by the end of the video. So if this topic is what you are keen to know about, I urge you to stay till the end of the video, and I promise you, you will learn a lot. But before I continue, if you haven't subscribed to my YouTube channel, please kindly do so now. And please do not forget to like and share this video. Drop your comments in the comment section and I would reply as well. So without wasting much time, let's dive right into the video. So in using the artificial family planning methods, there are two types. There is the barrier methods and then there is the hormonal methods of artificial family planning. The barrier methods works by physically stopping the sperm from getting to the uterus to fertilize the egg. Most barrier methods contain spermicides, and spermicides are chemicals that are hostile to sperm. Spermicide destroys sperm. Spermicides can kill sperm. Alright, so let's dive into the different types of barrier method. Number one is the condoms. Of course, we have the male and the female condoms. The work of the condoms is to prevent sperm from getting to the uterus to fertilize the egg. But then one disadvantage of using condoms is that it might break. And then when it breaks, it might result to pregnancy because the sperm must have entered into the female's uterus. It can result to pregnancy, like I said, and also it might result in the risk of contacting sexually transmitted diseases. Number two barrier method is the diaphragm. The diaphragm is placed over the cervix. Like the diaphragm is used to cover the cervix to prevent sperm from getting to the uterus to fertilize egg. Like I said, most times diaphragm contains spermicide, which I said is very hostile to sperm. The spermicide can kill sperm as well. Number three barrier method is the cervical cap. The cervical cap works just like the diaphragm. It is used to cover the cervix. It is placed over the cervix to prevent sperm from passing through. Both the cervical cap and the diaphragm needs to be placed by or needs to be put in place by a trained clinician. Don't go and do it by yourself, please. And it needs to be checked from time to time to be sure that it is still in place. Okay? Number four is the contraceptive gels and sponge. So, like the name implies, the gels and the sponges are inserted into the body. Alright, it's inserted into the vagina, and in turn, it makes the vaginal environment and the cervical environment very hostile for the sperm, thereby killing the sperm and preventing it from going to fertilize the eggs. Number five is the vaginal spermicides itself. The vaginal spermicides, like I said, they are chemicals which are very hostile to sperm and they destroy or kill the sperm, thereby making the sperm unable to go and fertilize the egg. Vaginal spermicide comes in the form of gels, foams, suppositories, tablets, etc. So when you use them, they help to prevent pregnancy. And that is that for the barrier methods. Now let us go to the hormonal methods of artificial family planning methods. The hormonal methods either contains estrogen and progestin, or only progestin. Like the name implies, hormonal methods. So this type of method, it releases these hormones into the female body, thereby preventing pregnancy. Most of these hormones prevent ovulation in a woman, and when you don't ovulate, you don't get pregnant. Now let us go through the types of hormonal family planning methods. Number one is the implant. The implant is very, very effective. In fact, it is 99% effective. The implant is just a rod-like device that is placed under the skin in your arm. Sometimes here, sometimes here. All right. So it is placed under the skin in the arms, and that is where it starts to emit or exude or bring out the hormones that helps prevent pregnancy. Like I said, it is very, very effective, and it can last for 3 to 5 years. It can. Number two, intrauterine device, the IUCD. The IUCD, or the copper T. The IUD is placed inside the uterus. And when it is placed inside the uterus, it helps to prevent pregnancy. The IUCD is very, very, very effective. In fact, it is also 99% effective. And it should be fitted in by a professional so that it can be able to work effectively. It can stay for 5 years and above. Yes. Number three is the injections. Of course, there are some injections that women take to help prevent pregnancy. Some women take this injection every 3 months, some every 1 month, some every 2 months. For example, the Depo-Provera. Okay, so some women take this medication. Some women take this injection to help keep up with their family planning. All right. Number four is the pills. There are different types of pills that a woman can take. The thing about pills is that they must be taken at the exact time every single day for it to be effective. I must say there are women who are very, very religious in taking their medications, that are very religious in taking these pills, thereby helping them to achieve this family planning. And then number five is the vaginal rings. As the name implies, these rings are placed inside the vagina, and in turn it helps to prevent ovulation, thereby preventing pregnancy as well. The last but not the least is the patches. These patches are placed on the skin, and wherever they are placed, they help to prevent pregnancy by exuding or bringing out hormones that will prevent pregnancy. All right. So like I promised, I said I was going to be telling us the disadvantages of using artificial family planning. Now, this is the disadvantages. Number one, there is weight gain or there is weight loss, but mostly women experience weight gain. Number two is hair loss, or you have excessive growth of hair over your face and body. Number three, some women can be depressed from using these methods, these artificial family planning methods, depression. Number four is the loss of sexual urge. Yes, there is loss of sexual urge. Number five is mood swings. So women can have mood swing while using these artificial family planning methods. Number six is changes in your menstrual cycle. It is either you bleed excessively or there is cessation of your menstruation. Number seven, there is headaches. Number eight, there is sore breasts. Your breasts will be sore at all times, so painful. Number eight is acne. You have acne all over your body. So having given you all these disadvantages, I must encourage you, if you have tried the natural family planning method and it didn't work out for you, please try the artificial family planning methods. It might work out for you. It is not all women that will have all the side effects that I've mentioned. No. That is why you have to talk to your healthcare provider. That is why you have to talk to your doctor, your nurse, to be able to know the type of family planning method that suits your body. If you go on to any type of family planning method and it is not suitable with your body, kindly and immediately report to your healthcare system and it will be immediately changed for you. And the one that is suitable for your body will also be given to you. If you have actually watched this video to this extent, that means you're interested in this video. Kindly subscribe to my YouTube channel, like this video, share it, and drop your comments as well. And I will see you in my next video. Bye.